Thank you so much for joining us today. I want to ask you about the POCUS Atlas initiative. Can you talk to us a little bit about that?
Yeah, sure. So the POCUS Atlas is a collaborative project essentially between me and then Mike Macias, who's currently a fellow at UCSD, and I'm a emergency medicine resident at Kings County. We were put in contact with each other through the founders of the Ultrasound podcast, so Matt Dawson and them. And we had a similar idea and objective to create an open source, free, open access collection of images, ultrasound images, in order to kind of give a horizontal educational tool for anyone interested in point of care ultrasound. And we just kind of had similar ideas and really built off each other's ideas, and it's kind of grown into what we have today.
And the whole open access movement in medical fields it's such a strong movement. Can you talk a little bit about what you hope to contribute to that movement?
Basically, there's a bunch of really good ultrasound education in the foam open access world already. And we saw a huge need for just a really good collection of images that would be easily searchable and for everyone. So we kind of capitalized on that opportunity. And we really want it to be like, if you're teaching, if you're working, if you're at the bedside with a patient and you see a finding or you want to show something like an abnormal thing, you want us to be where you go. Instead of like Google imaging an ultrasound image, we want you to go to the POCUS Atlas and find the perfect image for you. And then obviously have a little bit of evidence and research backing that clip too. So.
Can you walk through how somebody submits and then how you actually put that into the library, how you perhaps go through some of the quality controls to ensure that you really are getting some of the best material for people to use?
There's a really simple submission form on our website. And basically, you just fill in the field's name and then what the image is of, and then a little bit about the operating characteristics of the test. And then Mike and I will QA it and make sure that the images are really good, the technique is really good, and that we are in fact seeing what we think. And then when there are more difficult cases or things that we want expert consensus on, we have panels of attendings and really prominent ultrasonographers who we can reference to help make sure that all of our images are perfect, and we are looking at exactly what the ultrasonographer thinks that they're submitting.
Point of care ultrasound is really a growing field. It's growing in popularity and in usefulness, and some people say that it's sort of most revolutionary device or technology to come into the medical field since the stethoscope. So what's your perspective on that? What is your perspective on point of care ultrasound and how it's really changing the medical profession?
Oh my God, I love this question.
Yeah.
And I find whenever I talk about this project to anyone not in the medical field, it's always becoming cliche in that we say that that point of care ultrasound is going to replace the stethoscope. And we're pretty much certain of that now. And what was the way that you asked this question? So yeah, I'm really excited on point of care ultrasound. And it is, at least for clinical practice for emergency medicine, we can do it for every single patient. And, if every one of us ER docs had an ultrasound in their hand, we would not be using the stethoscope. Like, there's no question about it. Mm-hmm. We still use it. We still use the stethoscope because it makes our patients feel listened to. It really enhances the basic doctor-patient relationship. But as far as giving objective data, objective insight into the physiology of our patients, there's nothing better than point of care ultrasound. Yeah, and then also, as far as what the stethoscope did initially, right? It let us listen on the inside of humans And it does a really good job of that for sure. And, for centuries, it's given us a lot of useful clinical information. But now if I have a patient that comes in, really any any complaint, any medical issue, I can go and I can look inside them and I can see pretty quickly with pretty high accuracy what's happening, be it normal or abnormal. And I can know almost instantly when they come through the door.
How would you see events like the World Congress of Ultrasound and Medical Education? How do those play into perhaps breaking down certain myths about point-of-care ultrasound or creating more of that evidence-based dialogue that's needed? What role do you see events like WCUME playing in augmenting the usage and awareness of how useful POCUS is?
So there's still a tremendous amount of education needed for POCUS. I'm an ER resident, so I get really, really good POCUS training from day one of residency. But a lot of people who've been practicing, even just 5 years longer than me, 10 years longer than me, they might not have trained in POCUS at all. So events like the WCUME are still super important for educating those people, and then also promoting like the more academic side of, how good is point of care ultrasound at detecting a certain finding? How good is the test? Is the test reliable? Can we reproduce it? And it's still really, really, really important that if we're using point of care ultrasound and we know what we see, that we have data that supports it in our documentation and then communicating with other consultants and other services. So there's still a ton of growth in WCUME. The entire POCUS community still needs this and is definitely contributing to advancing the field.
We're really excited to be partnering with POCUS Atlas to bring the first ever Golden Probe Awards, a really fun initiative. Do you want to talk a little bit about that and explain what the awards are all about and how people can participate?
We're really excited about this project. Essentially, it is an ultrasound competition where participants are encouraged to submit their best ultrasound clips. And since there's a lot of different things that constitute best ultrasound clips, we're looking for best overall, best new indication for point-of-care ultrasound, and then the most creative caption for point-of-care ultrasound. So if you're out there and you're doing some really good ultrasound imaging right now, or maybe there's something that you have sitting on your desktop that you don't know what to do with, you don't have a lecture to give, you should really submit it to the Golden Probe Awards, and you can win a trip to, or really a conference admission to WCUME 2018. And in the process, you will get published on POCUS Atlas. You will get published on our Twitter feeds, and your awesome ultrasound images will be shared with hundreds of people throughout the world through our website and social media, and will be seen by thousands. And you will definitely be contributing, to the medical world and the POCUS movement.
Awesome. Well, you can't argue against that, can you? So thank you so much, and we'll make sure that we link to the POCUS Atlas website, your social channels, and give everybody information on how to participate.